Assalamu alaikum. My name is Akil Majid. I'm a student of pharmacy in UCP, Lahore. These are my group members and we have done project on ketamine under the supervision of Dr. Ghulam Jilani Khan. First, let's discuss about its origin. Ketamine, or should I say 2-chlorophenyl 2-methylaminochlorohexanol, is synthetically prepared by toluene by a number of reactions. Toluene or toluene was first extracted from pine oil in 1837 and then again from balsam in 1841 by Henry. Now let's talk about its isomers. Being a chiral compound, it has two enantiomers having different effects, S-ketamine and R-ketamine. As you can see, the difference between these two enantiomers, such as S-ketamine is more active and produce anesthetic effects, while R-ketamine is less active and produce hallucinating effects. Pharmacokinetics. Let's discuss about its pharmacokinetics. Ketamine has rapid onset of action, relatively short duration of action, water soluble and higher lipid solubility. Due to its high lipid solubility, it can cross blood-brain barrier and after absorption, it readily enters brain and then it undergoes extensive redistribution and accumulate in adipose tissues. It has low bioavailability via oral route as bile broke it down easily, but it gains its peak concentration in 1 minute via IV injection, while in 5 to 15 minutes via intramuscular injection. Its metabolism primarily occurs in liver and involves N-demethylation by cytochrome P450 system. It results in major metabolites norketamine and dehydronorketamine. Here are some bioavailabilities available via different routes. Rectally, its absorption is 30%, intranasal 8 to 50%, sublingual 30%, intramuscularly 93%. Now moving on to the pharmacodynamics. Initially developed as an anesthetic, also used as an analgesic and an antidepressant, used recreationally as well. After administration, ketamine is rapidly and extensively metabolized into an active metabolite called norketamine, which is thought to play an important role in ketamine's anesthetic and analgesic effects. Ketamine and norketamine both act as a receptor for neurotransmitter glutamate called the NMDA receptor. Glutamate is the primary excitatory neurotransmitter in the brain. Ketamine and norketamine act as antagonists at the NMDA receptor, which means they block the receptor and inhibit activity there. Inhibition of NMDA receptor can substantially affect the neurotransmission and is thought to be critical to the anesthetic and analgesic effects of ketamine. Antidepressant effects. One hypothesis is that another glutamate receptor known as AMPA receptor may play a key role. Its effect can occur rapidly and last for up to 2 weeks. The mechanism underlying ketamine's antidepressant action are not fully understood, but it's thought that it cannot be explained by NMDA receptor antagonist only. First, AMPA receptor may be stimulated directly by ketamine or indirectly by ketamine or directly by the ketamine metabolites such as hydroxynorketamine. Stimulation of AMPA receptor may lead to the activation of multiple signaling pathways and downstream effects such as new synapse formation in areas of the brain like prefrontal cortex and hippocampus. These synaptic connections may bolster neural circuits involved in regulating stress and mood. Now, as for the effect of ketamine goes, they are central nervous system effects, cardiovascular system effects, organ system effects, and respiratory system effects. We will discuss all of them one by one. Central nervous system effects. Since we know that ketamine is a cerebral vasodilator, so for this main reason, this ketamine drug is not recommended for patients with intracranial pathology. Now for the second effect, that is cardiovascular system. Ketamine significantly increases systemic blood pressure, heart rate, and cardiac output, For these reasons, ketamine is considered to be a direct myocardial depressant. Moving to the third point, that is organ system effects. Doesn't give a complete amnesia when given as sole anesthetic, as it gives complete amnesia as with benzodiazepines. Mostly the reflexes are preserved. Frequently lacrimation and salivation are increased. The eyes remains open and the pupils are moderately dilated. Now for the last point, that is respiratory effect. This effect is particularly important, especially in children, because of the risk of laryngospasm because of the increased salivation. But this risk can be reduced by pre-medication with anticholinergic drugs. On the other hand, since ketamine relaxes bronchial smooth muscle and it may be helpful for patients with reactive airways and also for patients with bronchoconstriction. Moving to the adverse effects of ketamine, which are anesthesia, emergence reaction, which can alter mood and cause delirium, hypertension and sinus tachycardia, hypotension, sinus bradycardia, apnea, pulmonary edema, respiratory depression, vivid dreams. Now for contraindications. Some of the contraindications are in patients suffering from hypertension, cardiac decompensation or cerebrovascular accident, for surgery of the pharynx, larynx or bronchi, in abdominal surgery as it relieves visceral pain poorly. Hypersensitivity to ketamine. Barbiturates and diazepam are chemically incompatible with ketamine. They should never be administered from the same syringe or via the same infusion set. Moving towards the dose of ketamine. Average dose of ketamine is 2 mg per kg and its onset of action is 10 to 13 seconds and its duration of action is 5 to 15 minutes. Now moving toward the ketamine poisoning. Ketamine poisoning is of two types: acute poisoning and chronic poisoning. Discussing about acute poisoning, it is mainly associated with hallucinating effects, but respiratory and CVC effect can occur. Chronic poisoning, it generally involves neuropsychological effects and neurotoxicity in addition to urological and gastrointestinal pathology. Now let's discuss some treatment to deal with this kind of poisoning. Basically, there is no single antidote for ketamine overdose, so the doctor have to examine you to give proper treatment. For example, if ketamine dangerously impairs one's breathing, the doctor may administer drug to improve respiration. In some cases, such as tumor or seizures, to slow them down, doctor may prescribe benzodiazepines. Lastly, for the abuse of ketamine, its first case was reported in 1980s. At extremely high dose, users have reported feeling as they were near death experience is happening. In Europe, it has been used as a day trip drug because it is odorless and colorless. Now, for its treatment, there are three plans, namely CBT, that stands for Cognitive Behavioral Therapy, DBT, that stands for Dialectical Behavioral Therapy, and ACT, that stands for Acceptance and Commitment Therapy.
Now we are moving towards the clinical uses of ketamine.
Nematicidal activity of ketamine. Isolation and characterization of molecules from the nematophagous fungus Pogonia chlamydosporia and testing these compounds on three nematodes: Cyanorhabditis elegans, Ancylostoma, Silenicum, and Ascaris. Studies have shown that nematicidal activity is due to presence of ketamine in these molecules taken from the fungus, and results demonstrate the nematicidal activity of ketamine in vivo and in vitro, thus confirming the nematicidal potential of the molecule present in the fungus P. chlamydosporia may consist of a new method of controlling parasites. A synergistic effect between ketamine and opioids has been observed in cancer patients who have lost an analgesic response to high doses of morphine. Ketamine is considered as an anticonvulsant and may be recommended for treatment of status epilepticus when more conventional drugs are ineffective. Its unique properties including profound analgesia, stimulation of sympathetic nervous system, bronchodilation, and minimal respiratory depression make ketamine an important alternative to other intravenous anesthetics. Moreover, ketamine can be administered by multiple routes, which includes intravenous, intramuscular, oral, rectal, epidural, thus making it a useful option for pre-medication in mentally challenged and uncooperative patients. Anesthetic ketamine induces both general and dissociative anesthesia in animals and humans. Ketamine is also used as an adjunct to local anesthetics in veterinary practice and in humans. Ketamine has an anti-inflammatory property that can skew macrophages to an MTO-like phenotype, highlighting the potential therapeutic implications not only for patients with MDD but also other inflammatory-based diseases. Sub-anesthetic doses of ketamine programs human monocytes into MC-like macrophages by inducing high levels of CD163 and MERTK with intermediate levels of CD64 and stimulating MTOR-associated gene expression in vitro. The anti-inflammatory effects of ketamine have been observed when drug was administered prior to and following an immune stimulation, indicating that ketamine may be able to prevent exacerbation of inflammation and also reduce existing inflammation. Ketamine has also been shown to correct abnormal inflammatory bone markers in major depressive disorder. A 38 years old female with neurofibromatosis type 1 with a history of chronic severe pain in her fingertips secondary to multiple glomus tumors which evolved into CRPS, resistant to multiple therapies but responsive to oral ketamine.
Now here are some brands which are available in the market for ketamine: Anicat, GBCat, Hypnocat, KetaCat, KetaCat V, KetaFast, and they are the types of injections. All are injections.